Let's get started with NBC News Capitol Hill correspondent Melanie Zanona, our public health experts, Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, and MSNBC medical contributor Dr. Vin Gupta. Also with us is MSNBC senior enterprise reporter Brandy Zadrozny. Mel, everybody is getting ready for this hearing. We haven't seen everyone take their seats just yet, but to set the stage, why was it important for senators to hear directly from Dr. Menarez?
Yeah, this is going to be a blockbuster hearing. This is the first time that she will be testifying publicly since she was fired. Now, she did outline the circumstances of her firing in the Wall Street Journal, but she has said some things that RFK Jr. has directly denied or pushed back on. So that is going to be a huge topic of discussion at today's hearings. But more broadly than that, lawmakers on both sides of the aisle want to know what type of pressure, if any, she was under to pursue anti-vaccine policy, if she was ever asked to defy scientific evidence. All of that could have potentially really big impacts on public health. And not to mention, there's also a key advisory board meeting coming up in the coming days about vaccine panels. So this is just a huge hearing, both for public impacts as well as for the political stakes. Senator Cassidy, he's the chairman of this committee. He's a Republican. He is someone who voted to impeach Donald Trump, and he was the one who decided to call this hearing in the first place. He's already facing a primary challenge from the right. There's a lot of concern among his allies that he could be sort of kicking the hornet's nest here. So we'll have to see whether Trump decides to come out and endorse against him, something he has not done yet. But just, again, a huge high-stakes moment here on Capitol Hill.
And we are seeing the witnesses just arrived and took their seats. Dr. Menarez is the far side, and closer to us in this camera shot is Dr. Howery. Mel, we'll let you get in a position to listen in for us. Thank you. Brandy, we just played that clip at the top of Kennedy's version of the firing of Dr. Menarez. She's expected to counter that today. What's her version?
Yeah, well, she says that there are two reasons that she was fired, and she outlines it in remarks that she's about to make that we got an advance copy of. And she says there were two things that were inconsistent with her oath of office and the ethics required of a public official. Number one, he directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. And that's that meeting that's coming up. And he also directed me to dismiss career officials responsible for vaccine policy without cause. And that is presumably Dr. Howery, who we're about to hear from, and also other CDC officials, the top people who also left and resigned in sort of frustration a couple weeks ago.
Dr. Gupta, what will you be listening for?
Well, it's astonishing what Brandy just said, that to be asked to pre-vet or pre-approve vaccines without any knowledge of the data and the science. You know, you need, as the CDC director, you have to actually know what's safe and what's effective, and have to look at the data before you can render your rubber stamp on it. And so just the fact that that was even part of the process is a huge red flag. I'll be looking just to see the reaction from Senator Bill Cassidy and some of the moderate members of this panel on the Republican side, because 82%, Anna, you and I have talked about this, 82% of the American public do believe in vaccine requirements for kids in schools, and that's, you know, going to be really important.
Dr. Offit, in her prepared remarks, which we will take live, that's our plan when she begins, but she says that she told Kennedy to fire her after he said he could not trust her. Do you think that was the right call?
Well, I think what Susan Menarez was asked to do was something that is directly against the health of this country. And it's not surprising in the sense, I don't know if you remember, but when RFK Jr. was confirmed, and story is out there, that he met with Peter Marks. So Peter Marks is the head of CBER, Centers for Biological Evaluation and Research, which is the sort of vaccines, biological part of the FDA. And he said to Peter, I want you to show me the data that shows that measles vaccine causes blindness and that measles vaccine causes deafness. And Peter Marks pushed back and said those data don't exist. The vaccine doesn't do that, for which he was fired. So in other words, you have to have these fixed, immutable, science-resistant beliefs that RFK Jr. has if you're going to stay within his Department of Health and Human Services. It's a dangerous time.
It's a dangerous time. So, Dr. Gupta, how courageous is it for her to be speaking out like this?
Well, it's a public service, and this is going to herald, as you mentioned, tomorrow's advisory committee on immunization practices will be meeting. And there's a lot of efforts to pre-bunk what we expect is going to happen there, which is a significant revisiting of critical vaccines for kids, and anywhere from the MMRV vaccine, measles, mumps, rubella, varicella vaccine, the combination vaccine, overstating risks, understating benefits, cherry picking evidence. Anna, we've seen this playbook, revisiting COVID vaccine indications, hepatitis B vaccines. That's going to be really interesting to see if this comes up with Senator Cassidy. Senator Cassidy, prior to his elected office, one of his signature accomplishments as a physician was actually driving hepatitis B vaccination uptake in Louisiana, in his home state. And now this is going to be likely revisited in some fashion in ACIP tomorrow and on Friday. And so let's look and see his reaction if any of that conversation comes out.
And he has called for that vaccine meeting, the advisory meeting, to be put on hold indefinitely or if they meet, for people not to follow their guidance, given the drama that has led up to this meeting. Dr. Offit, I know you have been in touch with Senator Cassidy in the past, and I understand you never got a reply to the public letter you had written to him in May, reminding him, quote, "It's not too late to do something about this." The senator has turned to you in the past to consult. If you were to speak with him now, what would you tell him?
Well, Senator Cassidy, when he voted yes, drew certain lines. He said that he's insisted that RFK Jr. not change ACIP recommendations, to which RFK Jr. agreed, and that he insisted that he not change essentially the way that the ACIP is constructed. So he's violated both of those original agreements. I think that if I could talk to Senator Cassidy, I would like to say, since he hasn't gone along with what you had him agree to, why is it that you're going to continue to have him be Secretary of Health and Human Services, since what he's doing is in direct contrast to what's best for the health of this country? It's really worrisome to watch all this play out. I feel sorry for Senator Cassidy. I know he's trying to do the right thing, but I think he's being asked to stand up and do something that I think he feels is against his best political interests, even though it would be best for the health of this country.
But does he even have the power to do anything realistically? I mean, he alone could not remove RFK Jr. as HHS secretary, could he?
No, well, see, this is why I'm not a politician. But what I would say is if it could come true, I would love to see him gather a group of other Republican senators like Senator Barrasso, Senator Tillis, and others, and then walk into President Trump's office and say, this man is a danger to the public health. And you can still have your MAHA movement and some of the benefits of the MAHA movement without having this anti-vaccine agenda being a central part of that movement.
We just were listening into Senator Cassidy's opening statement, and he did say that after this hearing, he would invite HHS officials or Secretary Kennedy to respond or refute anything that they hear that they feel a need to respond to. Brandy, I don't want to ignore the other person who's going to be testifying today, because she, too, has critical expertise and played a key role in the CDC, Dr. Deborah Howry, who, again, resigned in protest after Menares was fired. What's the significance of her testimony?
I mean, well, Dr. Howry, before there was Menares was in place, she was sort of running CDC for a long time. She has been there for decades. She has served under 4 administrations, I believe. She has led CDC through, some of the most turbulent times in the agency. And she says in her letter that we're about to hear her testimony, but she says under Secretary Kennedy, the committee, which she's very worried about, that vaccine committee, has been replaced with known critics of vaccines and operates under decreased transparency with a willful refusal to follow established scientific and decision-making procedures. We have heard from Dr. Howry, who said, she was willing to fight the good fight. She was willing to bring Kennedy in. Again, has worked with lots of different people, but she has seen just a willful refusal to follow the science where it actually leads, and she can't stay there anymore and continue to do good work under Secretary Kennedy's leadership.